Hi. Brain and Spine Hospitals offers endoscopic lumbar discectomy. Spinal column of the backbone is one of the important part of your body which allows you to stand upright, bend and twist. 33 individual bones lock with each other to form spinal column. C1 to C7 cervical vertebrae, T1 to T12 thoracic vertebrae, L1 to L5 lumbar vertebrae, 5 vertebrae of sacrum and 4 vertebrae of the coccyx are fused. Between each of the movable vertebrae there are located intervertebral discs. The disc consists of thick outer layer with fibrous structure and soft inside is the soft gel-like center. Directly behind the disc the ring-like vertebrae body forms the spinal canal or nerve canal. The spinal cord and spinal nerves pass through the spinal canal which protects them from injury. The spinal cord is the major column of nerve tissue connected to the brain and serves as an information highway between brain and body. The nerves in the spinal cord branch off to form pairs of nerves root that travel through small opening of your vertebrae intervertebral foramens. This is a condition of a normal lumbar intervertebral disc. As the disc degenerates and breaks down, the inner core can leak out through the outer portion of the disc. This condition is known as the disc herniation, which puts the direct pressure on the nerves. Disc herniation symptom includes low back pain, leg and buttocks pain, leg numbness and tingling sensation. Endoscopic lumbar discectomy is minimal invasive procedure for treating lumbar herniated disc. Using special instruments your surgeons can remove the herniation by relaxing nerve root compression. Advantages of endoscopic lumbar discectomy includes the following: minimal invasive, short recovery, high success rate, minimal to no blood loss, less hours of hospital stay. Welcome to Brain and Spine Hospitals, Chennai, India. Enriching lives.